Okay, there's the mute button. All of a sudden I lost my screen. So can you see the presentation and hear me okay?
Yes.
Okay, awesome. Give me 1 second, let me just adjust this. Okay, so my name is Hunter and I'm the project lead on the Basic Respirator project. Today, I'm going to walk you through the project and how it's progressed. So it's grown quite a lot in the past year and a half, especially thanks to help from Jogel in the community. So I want to show you some of our plans for the future as well. And hopefully this will encourage some further discussion about inclusivity within healthcare. So this is the problem that I am focused on right now, which is N95 respirators used in healthcare. So I began it last year during the shortage when I chipped in to help make PPE for local hospitals, and it's grown from there. So during my research, I learned that over 70% of healthcare workers worldwide are women, and many are people of color, yet they're wearing personal protective equipment that is designed for white men. And I mean this literally. At least in the US, the data that manufacturers based their designs on was collected from the military in the 1960s, and they were all young, athletic, fit white men. And that doesn't reflect the diversity that is in healthcare today, especially with frontline workers. The problem that this creates, primarily it's a safety issue and it's also a comfort issue. But when you wear masks that are too large for your face, you have to tie it so tightly it causes bruising and sores. And so the pictures of this demonstrate that. And every time I see these pictures, I'm a bit overwhelmed with emotion about how much pain this is happening, and how much pain and suffering that this is causing. And I'm not sure if there's as much media attention on it anymore. And so that's part of this project, is just to find out how much suffering is happening and what we can do to solve that. But there's another aspect to this problem too. Hospitals tend to prefer disposable masks for many reasons, primarily safety and ease of use and cost. But especially with the pandemic right now that's happening, the environmental costs are too great to ignore. Currently, this is a real statistic, 129 billion masks are discarded every month. That's like 3.4 million a minute. They end up in landfills where they leak pollutants into groundwater. They break down into microplastics and nanoplastics, and the rest are incinerated. And this is dumping millions of tons of CO2 in the atmosphere every single month. So to solve these issues, we've developed an integrated solution that delivers a custom fitted and reusable device. And so first, what we have is actually a mobile application. It's a mobile AR application called QuipFit. It scans your head in 3D to determine your mask size. The sizes are based on published research by NIOSH and are meant to fit 95% of the US population. And so there's the 3D scan. It also helps you perform a virtual fit check with the mask in your chosen size. So healthcare facilities are required by law to fit check their employees every year to determine their correct mask size, and they do qualitative fit testing to make sure that it works. This app is designed to reduce the amount of labor and time in that process to identify the mask size that fits that more quickly. There's another aspect of this too, which I'll get into the next slide. But first, we'll talk about the respirator. So the respirator itself is a new category in the healthcare market. It's lightweight, like a disposable respirator on the left, but it offers the tight seal and protection of a reusable elastomeric device. So it doesn't fog glasses or goggles, and it's comfortable to wear. So again, on the right, this is a reusable device, offers a much tighter seal. But it is hot and uncomfortable, intimidating to wear, and it also has an exhaust valve, so it doesn't offer that two-way protection. The mask that we've designed does offer that, so it's a new category, but it is still a surgical N95 respirator. And this is just a sort of technical diagram. It is modular. So this is where it gets to the environmental aspect of it, and thinking about the circular economy and being more efficient with our use of materials. The components can be sterilized and reused over and over. There is an N95 filter that fits in the middle, but it's about 1/3 of the size of a disposable mask. So this greatly reduces waste on its own. And then there's a magnetic harness for quick and safe donning and doffing. I mean, the biggest aspect of this mask is that it's more comfortable than other masks, primarily because it fits, but also because it's lightweight and there are some features that make it softer and more comfortable to wear. So, you know, the project is expanded to something much larger. So this has actually become my startup, and I'm planning to expand into potentially into other markets. So I see respirators as only the beginning. We also have a proprietary CAD modeling pipeline that we're developing. And I think that with additive manufacturing, AKA 3D printing, we have the ability to make wearable protective equipment that is designed to fit your body exactly and can also be printed on site. So that's my vision for the future in, you know, the next 5 to 10 years. That's what I envision. I think also with additive manufacturing, it greatly reduces transportation costs. So if something can be printed on site or even locally, that's gonna also reduce CO2 emissions. The other aspect of this too is with the software technology that we have. So right now we're producing respirators, which is an incredibly difficult product to fit. But there are other products that are maybe a little less difficult to fit, but could equally benefit from this kind of technology. So I see product development in other industries. CPAP masks are a big one. There's lots of different medical devices that are worn on the face, orthotics, prosthetics, and even athletic wear. So what we're doing for the head and the face can be expanded to the rest of the body. And all of these would be designed to fit you specifically and made from sustainable materials. So our next step is we are executing a pilot program within healthcare facilities. That's going to be starting in November. So I have a few healthcare networks that are interested. This is kind of a complicated chart of all the things that we need to do, but I'd like to interview customers to understand both the fit and the comfort issues and just problems with respirators in general. We're going to be deploying the app as well to find out, does the app help with fit testing, and actually start to collect some data on people. And so this is the inclusivity aspect of it, is to collect data and 3D facial scans on people and find out, are they wearing the correct size respirator for themselves? Are they wearing the correct size respirator? And if not, what respirator should they be wearing? The other thing I'd like to find out with the app specifically is whether or not it can help with inventory management, especially over over a large healthcare network, or even within, for instance, Los Angeles County itself. If we had that data on our healthcare workers and a future pandemic were to arise, perhaps it could be a lot easier to manage inventory, since we know employees' face sizes and can try to get the respirator that fits them the best. And then the other aspect of this will be testing the respirator itself, the physical device, and seeing how that works in a healthcare environment. Since it is reusable, sterilization is going to be a big part of this testing. So we want to find out, can it easily be sterilized, and what are the costs? What is the monetary cost of that? And then what is the environmental cost of that? Our company just got accepted into the Los Angeles Clean Tech Incubator. And so as part of that, as part of my participation in that program, I'm going to need to determine if this new product and this new process actually saves, has a net impact on the environment. So I'm going to collect some data to do that. Yeah, that's, I'll leave it up to, hopefully this, spawn some further discussion and some curiosity. So I'll leave it up to everyone to ask questions.
I think you have a question in the chat.
I do. Okay. I cannot see it. Let me stop sharing. I'm gonna stop sharing.
Thank you. I'm gonna resume in case we have any cool discussions now as well together. Does anyone want to share what they talked about in their room? What kind of conclusions, any interesting point that came up?
I can share something because we started talking about crowd investing, and I mentioned and how that relates to inclusivity in healthcare. And I mentioned that the the majority of the VCs in the U.S. are white men, and so they tend to invest in products that are for men. But with crowd investing now, there's an opportunity for more women and people of color to get involved in investing, and that maybe this can help open up new people and new companies designing products for those markets. So that kind of comes to the source of this is the biggest problem that you have as a startup founder. If you have a product, is where do I find money? And so finding different sources of money that's where you should start.
Absolutely, yeah, that makes a lot of sense. So is that is that an idea you're kind of considering now?
Yeah, it's always been in the back of my mind. Time. So it's a lot to produce a crowd investing campaign. So I think once I start to build out a bigger team, that might be more of a possibility. But it's definitely something that's in the back of my mind. It's something I'm looking to do. I will take money from anybody. I am not as long as they don't tell me what to do.
Absolutely, that's what I was going to say with crowdfunding.
Yeah.
It's nice because you do have more power at the end of the day, isn't there? So nice one.
Yeah.
Anyone else? Camille and Eloisa, I wonder what you guys were chatting about. You're on mute.
Yes, we've had quite an interesting and robust discussion. I'll try to highlight some of the main elements. We went back to the concept of inclusivity. What exactly do we mean about inclusivity? And I think the basic understanding we came up with is, how does healthcare address the needs of everybody rather than particular aspects of the community? And in that breath, we discussed what are the gaps, or what are some of the issues that we can point doesn't represent inclusivity. And so that would kind of be issues that people interested in addressing inclusivity in healthcare can begin to work on. Two of the issues that we pointed out, for example, was lack of access to basic diagnosis. For example, in the context of COVID-19 in some countries, either they don't have the resources to be able to fund public testing programs, or for some political reasons, governments are not allowing consistent testing. So this can be impediments, because access to diagnosis, for example, can have effects on the kind of care, and even in terms of the policy that is put in place to improve health. Another thing that we also talked about is, in this era of precision medicine, lack of reliable genomic data in different countries around the world. So, for example, in many African countries, in fact, all across Africa, when it comes to genomic data for cancer, for example, it's very limited, very little proportion to the global genomic data set. Meanwhile, Africa itself is so diverse in its genetics, genetic diversity on the continent itself. And what this means is that the kinds of solutions that are coming out globally to deal with cancer will not address needs in Africa, but it's the same in other regions, certain other regions of the world, like communities in South America, etc., will face these issues. And so that's also talking about inclusivity from an innovation standpoint, and having access to services at the end. We also talked about potentially, when we say our ideal scenario when it comes to inclusivity in healthcare, what are some of the things that we want to see in that scenario? And some points were made about, for example, making universal healthcare globally accessible. So, for example, Brazil has some interesting I mean, everybody can go to a public hospital, for example, to access healthcare, as inefficient as it may be in some instances. In Ghana, for example, we have the CHIPS compound concept, which means that certain basic services are available in almost every community around the country in terms of dealing with community care, although, again, some important services may be absent. So there are some solutions there, but how do we identify some of the interesting solutions around the world, make it available to everybody, improve health literacy, and just solve different aspects of this concept of health system strengthening? That would be useful. Yeah. Sorry for my lecture.
Well, thank you for your lecture.
Maybe if I can build on this, I feel like inclusivity is the contrary to what we lived in the last 18 months, with a few people deciding about one kind of measure that is closed source. Whereas if we would like to be inclusive, we could really use technologies to invite people to reflect on their health and to collectively develop solutions, and to ensure that the solutions developed are in open access, can be reproduced and improved. And I feel that there are a lot of studies that shows that open source methodology is more like ethical, it's really cost efficient. But there is still this layer of law and economics that says, oh no, you must compete and you must close your things and you must use the resources to improve your own wealth instead of working differently. So yeah.
Fair. Yeah, that's Hunter again, like that's a kind of a subject that you've been really grappling with, like this kind of starting as an open source project and where does it go after that? And it's just, it's so true, it's a challenge, but I don't think open source means that it can't go to market eventually. And so, yeah, there's a lot to navigate around that. We're pretty close to time, and I know that you have to go at least, Hunter. So if anyone has any closing remarks.
This is awesome discussion with so few people. So I would say that this this sort of template for meetings works, because I'm surprised at how much came out of it and how many ideas I hadn't thought about before. So it's, I mean, now I have way more stuff to think about that I just can't. But this is great, and this is very valuable to me. It's hard because we're like so few people working against like huge systemic changes, but this is where it starts. So I appreciate everybody that came and contributed and listened to me drone about my stuff.
Amen. Thank you for your presentation, and thank you everyone for being here and participating. Have a lovely evening, day, morning.
All right. Bye, everyone.
Thank you. Bye.
Bye.